So when people come to see me for reflux testing, there's really three main tests that I like to order. So the first one that I always get is what we call an esophagram. It's where I send you to radiology. They have you drink some contrast down, they take x-rays and watch it move through your esophagus. As they take those x-rays, it gives me a good look at the anatomy of the esophagus, whether there's any hiatal hernia, and whether there might be any common esophageal causes that could be causing some of your symptoms. The next two tests that I do almost exclusively when I work people up for reflux is an upper endoscopy, an EGD, where I go down and I take a look with a camera while you're asleep. I take a look down the back of your throat, your esophagus, your stomach, the first part of your small bowel. Usually while I'm in there, I take some routine biopsies, and obviously if anything looks abnormal, I'll take biopsies of that too. The third test I do when you're asleep for your endoscopy, and it's what we call a 48-hour pH barometer. It's this little microchip. It's not much bigger than a vitamin that you may take. It suctions to the wall of your esophagus, and it looks at how much acid's coming up into your esophagus. It's a 2-day long test. So we've suctioned that device to your esophagus. You carry around a box for the next 2 days. The chip transmits to the box and it looks at how much acid comes up. That box has some buttons on it. It lets me know when you're eating, when you're laying down, and then 3 symbols in the middle that we program for symptoms that you can press anytime you're having their 3 top symptoms that you come to see me for. You bring that box back to wherever we do the endoscopy, and then I analyze those tests and I come back, and when you come back, we talk about those in clinic. The other 2 tests that I order based on symptoms are what we call high-resolution manometry, which is a bit of an uncomfortable test, but we numb up your nose really well and put a catheter down through your nose and into your esophagus, and it looks at how well your esophagus is squeezing things through. I think it's important to get that sometimes to look at the esophageal squeezing function and make sure there's not a primary esophageal problem that could be causing your symptoms. The other one that is sometimes ordered is what we call a gastric emptying study. It's also where I send you to radiology. You eat breakfast, but really the important part of the breakfast is the eggs. It has a radio tracer in it. Then we watch that radio tracer empty out of your stomach over the next 4 hours. If more than 10% of that is left in your stomach after 4 hours, it gives us the diagnosis of what's called gastroparesis, or poor stomach emptying. And those can sometimes go hand in hand with reflux, and sometimes that can actually be the cause of your diagnosis, and it's not actually reflux that's causing your symptoms. So with those tests, you come back after I get all that information. We talk about all that information at the next visit. I analyze all those testing myself. We bring the picture together, and that really gives us an overarching or overview of what could be possibly going on with your reflux disease.